Good morning, everybody. Good morning. Well, I am so excited to be up here this morning and to be in the room with all of you. My name is Tamara Smith. I am the Associate Vice President for Health Equity and Social Impact Strategy Advancement at Humana. And this morning, I am joined by two very distinguished individuals, leaders in our industry that I'm thrilled to introduce to you in just a moment. But quickly, I would like to just make this more of a, not necessarily a formal panel, but an intimate conversation, if you will, between colleagues and partners. We've heard the word partnership quite a bit through other panels this morning and our fireside chats, and we just want to continue to pull that thread as we go through. So in our panel, we will be discussing the power of community to advance health equity. It's sort of been resonant in many of the comments made throughout the day, and we're really going to pull that thread a little bit more. We know that when it comes to advancing health equity, the reason why this topic is so important is because health equity, in order to achieve health equity, we're really talking about redistributing power and resources into communities that have been marginalized or minoritized. And so that is impossible if we're not partnering to make sure we understand where those resources need to be distributed in order to create equity. So I am thrilled to have Dr. Keith Leaphart, who is down here on my far left, who is the Executive Vice President and Chief Health Equity and Community Impact Officer at Thomas Jefferson University and Health System. Good morning.
Good
As
morning.
well as Dr. Maya Price, who is the president of the Root Cause Coalition. Good morning, Maya.
Good morning, good morning.
All right. Thank you both for joining this panel, and let's jump right in. So I would like to start with something that is probably, in my opinion, the most foundational part. We actually heard Dr. Smith earlier mention this a little bit, of empowerment, which is having a voice. So when we think about community, when we think about redistributing power, Maya, you've had a long career in advocacy, also working in community. So I'll start with you. How can communities most effectively advocate for health equity, particularly in underserved or marginalized populations?
Yes, thank you, Tamara, and thank you all for this opportunity today. Before I dive in, I just want to say that I am fired up this morning. Being able to hear from so many incredible panelists and so many conversations has really sparked my excitement and also the passion for what I do. Just a quick tidbit about me is a lot of the conversations that we're having today when we are talking about underserved communities and population really mirrors the life of my own personal lived experience. I was born and raised in Kentucky. I grew up in a single-parent household in which a lot of what we and my sister relied on is my mother and her income. I was born and raised in a family where a lot of my own siblings, grandparents face hypertension, face diabetes, and other health disparities that really served at this kind of mechanism of what we are experiencing today at the national stage and also the conversations that we are having in this room today. So a lot of what I do today, I take very personal. I bring much more perspective from a human-centered design in which in everything that I do, I think about my own lived experience as I'm having conversations with communities, with others who look just like me, who have walked the same walk or either have not walked the same walk as me. It's very critical. So a lot of my work has started in community, having conversations on the ground, advocating, going to neighborhood council meetings, going into communities and trying to understand what are some of those disparities that we are seeing each and every day that may not always be at the surface, but be those underlying issues. And let's have a conversation around those. And so in Kentucky, did a lot of work, grassroots building, grassroots development, coalition building. And even today in Washington, D.C., I am so honored to be able to lead the Root Cause Coalition. We are a nationally based entity really bringing a collection of so many critical voices to the table. whether we are walking the talk and talking to food banks, whether we are talking to healthcare providers, food banks, and so many different entities, we are a coalition that is going hand in hand together and having conversations about so many disparities that individuals across this nation are facing. And so for me, this work is powerful. It's powerful in that it's important to build trust, be able to come to forums like today and have conversations that we naturally don't have. We may come from so many different perspectives, but we all have a story. We all have witnessed. We've talked to individuals who are facing disparities. So for me, voice is powerful. We need to have much more conversations. We need to be advocating. We need to be supporting each other because we all have a role to play in reducing health care disparities and reducing so many inequities that show up in our personal lives each and every day. So I am super pumped to be here today. And I'm going to turn it back over to you because I don't want to take up all the time.
Well, I'm going to ask Keith the same question, but I think what I heard is that you're really listening with two voices, right? The voice of your lived experiences, right? The voice that has informed you based off of what you've observed, what you've experienced yourself, and you're taking that voice with you as a leader into spaces where we're making decisions, right? And I think that's something that's critical, that whether we're, really conscious of it or not, just like that was, talked about in the panel before this one, is our bias is still informing us, right? But there's an opportunity to harness our lived experiences, that voice that came along with that, to help inform how we're making decisions as leaders in this space. Yeah, so, Keith, let's hear from you on voice.
So, good morning, everyone. As you can see, I'm the member of the panel who wasn't on the group text. They came with their red. I did not. Should have known that. So, my name is Dr. Keith Leaphart. I'm a physician, physiatrist by training, now serve as Chief Health Equity and Community Impact Officer at Jefferson in Philadelphia. We are a 32 hospital system. We have a university and a health plan. But I have to say, like many, many years ago when I finished my residency, I was somewhat really disenfranchised and mad at the healthcare system as a whole for multiple reasons. One, the people who I grew up wanting to serve. I dreamed of becoming a family practice physician that was going to be able to have you come into my office. We sit down and talk for an hour. We have fruit. We talk about your That wasn't, the doctor I could be. I always said the doctor I wanted to be when I was 5 wasn't the doctor I could be when I was 25. And so, I left my residency and immediately considered run for Congress. I said, most of the people I want to help don't even have health care. And this was before the ACA or Obamacare, people in the neighborhood. And I'm like, what can I do? This is really frustrating. And so thankfully, I didn't end up running for Congress. I opened up an exploratory committee. But what it did, it really connected me to the philanthropic sector in the city of Philadelphia. So I chaired the board of a large foundation. We distributed close to $1 billion to different organizations. I had a portfolio, it was around $300 million, that was able to direct dollars to now organizations that are, now we call the social determinants of health, right? So housing, economic, workforce development, all these things. And so for me, I saw, the community as essential to this process. And even in our decision making, when it was related to philanthropy, it was like, we can't sit up here in this boardroom and talk about the community, make decisions around where dollars should go. And listen, I'm a black man who grew up in the city, but I've been away from the hood for a while, as far as like living there every day, right? And who I was 20, 30 years ago is not the person I am today. So I can't really talk about what is going on. How do we have organizations that are close to the ground in the room? And so what we did in that space, we opened up the doors, brought in to be on our program committee. I've taken that role now as Chief Health Equity and Community Impact Officer, and I always say my biggest role within that system is to build trust, right? Mm-hmm. Because we all know that, healthcare is a part of an inequitable society. We've heard that today. We're part of a society where, unfortunately, there have been so many things that have happened to people of color, marginalized people that have put them in the conditions that they are. We all know there is a connection around, economic issues, education, things like that. And so I'm really focusing on day-to-day building trust in communities, being authentic, showing up, and as we talked about before, knowing that this is hard work. This is not what we did yesterday. We can't pat ourselves on the back. We got to show up and do it again tomorrow, right? Because there are, hundreds of years of history of mistreatment of people that we have to show up each day. So I'm really focusing on building trust with communities.
I think that is so critical, so important, and really can't be understated. I mean, let's just talk about the pink elephant in the room. I work for Humana. Most communities, especially communities that have been marginalized, are not exactly trusting of seeing Humana, right, come into the community and say, we want to invest, we want to do this program, because the assumption and the expectation that the community has a lot of times when you look at healthcare institutions is that we're there, we do something for 12 months, it didn't work in 12 months because, I mean, spoiler alert, it didn't take 12 months to get into this mess, right? Yeah. But then we pull funding, right? And so the trust really becomes damaged. And so this approach of really leading by listening is really, really critical to, one, make sure that we even understand the experience, the lived experience of those in the community. Now, you mentioned something, Keith, about wanting to run for Congress.
I was crazy back then.
Well, not too far off, because I think what I heard in that is understanding how the system works. And understanding that, you know what, in order to make change, in order to actually make this accessible and fair, we have to change policy. Absolutely. We have to address policy. So that brings me to the next question I want to ask, which is thinking about policy. And we all understand that when we're talking about redistributing resources, a lot of times that is driven heavily by the policy and by the laws and the structure of those policies. So how can healthcare systems better collaborate with communities to ensure that policies and services reflect the needs of those that are in the community?
You know, one of the things I always say, as a large healthcare system, we are anchors in the community. We also have relationships with both the government, so we have advocacy divisions as well as philanthropy. And we can't be so selfish in our ask at times, right? Oftentimes we go in and we're advocating for something that benefits us, and it may or may not, whether it benefits the community, may not be the first priority, right? But I'm proud to say that definitely in Pennsylvania, you know, we've done a really effective job, and not just our system, but all the healthcare systems. One, working with some of the community partners, but also working with our elected officials and saying, hey, these are the critical issues that are affecting the people that we serve. You know, women, right? Women around childbirth, you know, making sure that they have food and they're not food insecure. Young people coming out of prison. Unfortunately, I live in Philadelphia. We used to have the highest incarceration rate in the country. You know, we were the poorest big city, have been the poorest big city for a long time, so we have really entrenched deep generational poverty. So how can we make sure people who are coming out of prison can get connected to healthcare, right? And so, you know, putting together, we really, really worked hard with our legislators and now our Commissioner for the Department of Health and Human Services there for our 1115 waiver, right, that we're trying to get, right? And so, like, pushing and working together, we're now seeing the fruits of our labor come together. You know, making sure that children are, you know, have child care, guaranteed to have health care from the time they're born to 6 years old, so they can stay on the roads, right? So those types of things, just working together collaboratively with both, you know, our legislators as well as the community. Community shows we have the data. We all do our social needs screening. That is really just a data repository of where should we be focusing our advocacy for people.
That's right. And it sounds like what you're able to do to support community in this effort is leverage your position as a large healthcare organization, probably a large employer, to bring legislators into the room to help push for some of this work.
Absolutely.
Maya, what would you say?
Yes, so what's, again, kind of going back to the power of the Root Cause Coalition is that we are a coalition nationally based that are bringing together a collective of so many different perspectives to the table. And what's incredible about our coalition members is whether you are coming from the healthcare provider perspective, hospital perspective, food bank perspective, institution perspective, we are providing a platform that allows voices to be heard, allows entities to come together and think about how can we advocate on behalf of a moving policy, a moving platform together. So whether that is from sign-on letters, whether that is from tracking what is moving and how we can build together. You mentioned the 1115 waivers. We've been working on that together as a coalition. And so what we've realized through the Root Cause Coalition is that we have these different pillars, whether we're thinking about our advocacy committee, engaging our committee members around how can we go to the Hill, how can we go to Congress, how can we go to the administration and have an advocacy day where it's just not you having conversations, but it's all hundreds of us coming together to move policy, to make impact. One thing that's been incredible about our coalition is that when we're talking about engagement at all levels, we have coalition members that are representative of the local level, regional level, community level, national level. So we're getting all these different perspectives at so many different levels that are engaged around policy movement. And that is so big. That is so big in itself. So I think thinking about it that way in order to make an impact is one thing we've seen has been incredible.
Wow, I love the approach of having power in numbers, you know. And I think along with that is this concept of, okay, once we start to gain momentum and once we start to really, you know, move our message down the road, we've got the community engaged, we've built trust, right? How do we build and maintain capacity in communities to make sure that, you know, because everybody's not going to stay along for the whole ride. And what you don't want to happen is that at some point it all falls apart because the capacity wasn't built to sustain all of that effort. So let's talk about capacity building for a moment. I don't know who wants to go first. Keith seems like he's ready.
No, I'll jump in and say, to me, it really starts with leadership at the top, especially in large organizations where, you know, I heard the young lady, I think was with Gilead, and she said she was, you know, coming to an event and heard her CEO talk about the importance of equity. If they're matching dollars to that, then you know you have commitment. And same with, you know, my system. When I came over there, you know, the reason why I came there was, one, I was really impressed with our CEO and how much he was talking about challenging me on the community as a white man that I probably didn't think he had, you know, had that leaning, right? But he's so, every time I talk to him, he's challenging me about something. So I think it starts at the top, right? Because we're all going to move out of this position, but it has to be something that is embedded in the culture, and each one of us. And it is really, really hard work because, yes, we get the momentum, things are happening, but then you look in the paper or you look and you see, oh my gosh, one of our hospitals did something stupid that negatively affected, you know, someone in the community. And so now you're working against that as well. And so it really is about consistency. It's about all of us looking ourselves in the eye and, you know, facing our own kind of internal biases. I sit here, as I said, I've been away from the hood for a long time, but I've been a black man a long time as well. And so I've been able to navigate and sit and show up in healthcare systems. And whenever I would go, unfortunately, my mother and my sister passed away really early, you know, due to cancer. And whenever I would go with their care, I never showed up as Dr. Keith Leaphart. I always showed up typically in sweats and casual as a black man. And the difference in the care and the difference in the attention, when I just showed up sitting there, understated, they didn't realize that I was on the CEO's advisory board of the organization. Like, the total, it shouldn't be that way.
That's right.
Right? It shouldn't be that way. The same thing when I was in medical school, in my residency, and you would see your colleagues speak to you inside the healthcare system, but will not speak to you on the streets walking down, literally outside. We'll look the other way, right? And so if that is the people who are treating our patients, we have a problem.
That's right. That's good.
And I'm going to add, I've been a black woman for a long time.
Are you
trust
sure?
Me,
Are you
yes,
sure?
Absolutely, 100%.
That's in question these days.
Absolutely. And I'll tell anyone this, and I'll sit down and have a conversation with you. I never forget my roots and where I come from. And I have conversations with my mom each and every day, and she doesn't allow me to forget either. But just to build on that, I think that it really starts with commitments. We have to be committed. And I think a lot of times we make these transactional commitments where I'm going to give you something, but then I also expect something back. And we need to move from the transactional commitments to transformational commitments. Transforming not only who we are as leaders, our organizations, but transforming that we may not always know what that outcome is going to be, but we're so committed, we're so invested that we are going to do everything in our power to support individuals, support communities, and to ensure that individuals have a seat at the table. So one, it starts with commitment. Two, it starts with knowing that and offering seats at the table.
Yeah.
A lot of times it's so easy to have conversations behind closed doors or behind our four walls, but being able and willing to open up those doors and to provide space and seats at the tables that allow individuals to feel part of the movement, to feel like their voice is being heard. And trust me, that will go a long way. By doing just that, moving from transactional to transformational, you're already opening up those doors. And so what we've realized and what I've realized as the president of our coalition is moving and shifting in ways that allow so many individuals to join our coalition.
Right.
And then that is opening up the doors at a regional level, and then that is opening up more doors at a national level. So I think that with that, and the last point I will make is sustainability. We gotta stay in the fight. And I know that it gets hard sometimes, and I know it gets tiring sometimes, but we have to stay in the fight. And the way we do that is reminding who we are, where we came from, and why your mission, our mission matters, why this conversation today matters, and really centering that in our why. Why do we do what we do, and how can we continue to move that forward?
Well said. Okay, we have less than a minute, so I'm going to close us out with a challenge, okay? There are a few things that have been said that I'll just pick up on, actually, your last comment around commitment. Commitment and sustainability, staying in this fight, staying in the work. So I would love to see, before we leave out of here today, our partners here in the room that have been a part of this conversation with us make a commitment to perhaps join the Root Cause Coalition.
Yes.
Be one of the organizations that joins the coalition and partners with Maya in this work. Join with Keith. You know, as a large healthcare system in the Philadelphia area, there is a myriad of opportunity to address needs here. Even I'm going to hold myself accountable. As Humana, we have a need to really make sure that we are addressing, from a health equity, looking at communities across the nation. We have a need from to make sure that we're partnering with organizations that are specifically serving our Native American and Indigenous populations. Absolutely. We have a gap there. And so I'm looking for partners in the room today that I can walk out of here with a committed partnership, a commitment with our partnership. Doesn't mean that it has to be $1 million. Somebody said that earlier. But it does have to be something that's intentional and meaningful. So I challenge everybody in the room with that today. Maya and Keith, thank you so much.
Thank you.
Thank you.
Thank you all.